Hey, 23. If someone's vomiting a lot, that can lead to esophageal rupture or tear. What syndrome is that called? It's called Boerhaave's syndrome. Boerhaave's syndrome. What's the best diagnostic test for esophageal perforation? The best, the best diagnostic test for esophageal perforation is a water-soluble contrast. What medication can be used to reverse warfarin effect in a bleeding patient? The prothrombin complex concentrate can be used to reverse warfarin's effects in a bleeding patient. What are the number one causes of asthma? What's the number one cause of asthma? Dust mites. For obstructive sleep apnea, what is the mnemonic to remember the diagnosis? Stop bang. And how do you actually, what's the gold standard to diagnose obstructive sleep apnea? Polysomnography. The sensitivity of a test is an expression of how well the test will detect the condition. True or false? It's true. If you have a patient who all of a sudden is into the fitness and gym and athletics, or if that stuff's mentioned even, what should you be concerned about? Should be concerned about steroid use. What value and what is the value for statistically significant? It's the p-value and it needs to be less than 0.05. Repeating primary analysis calculations after modifying certain criteria or variable ranges is called what? It is called sensitivity analysis. What sort of studies, risk, and disease status are obtained at the same time? In cross-sectional studies, cross-sectional studies, risk, and disease status are obtained at the same time. Increasing the sample size in a study makes it easier to tell the difference if what exists. If there's a difference that exists, right? If you have concern for making a diagnosis of cystic fibrosis, what's the main sort of things that you want to start with? A medical history and family history, right? True or false? Higher risk patients should get a colon screen before the age of 50, 40, or 10 years before before relatives that had colon cancer. Is that true or false? It is true. What medication can be used to treat hyperthyroidism? Methimazole. Methimazole can be used to treat hyperthyroidism. So here's something to keep in mind. Good handoffs have the patient's demographics, status, the care plan, any sort of anticipated problems and actions that need to be taken right now and in the future, and ways to follow up on the patient. So keep that in mind. So what sort of biopsy is used to treat biopsy-proven lobular carcinoma in situ? An excisional biopsy is used to treat biopsy-proven lobular carcinoma in situ. Patients on aspirin and warfarin that have prostatic valves should still aim for INR in what range? In between 2 and 3 range. What sort of training can help schizophrenic patients? Social skills training. Social skills training can help schizophrenic patients. Zinc or petrolatum treats what with babies? Diaper dermatitis, right? So diaper dermatitis can be treated with zinc or petrolatum. If inguinal folds and beefy, then that is candida and you need to use an antifungal. What sort of therapy can help with obsessive compulsive disorder? Will it be exposure and response prevention therapy can help with OCD? What sort of medications can be used to help treat obsessive compulsive disorder? SSRIs like sertraline. So you have a patient who needs organ transplant and someone that's passing away. So in the person that's passing away, what needs to be done with regard to their organs in order for them to be good enough to harvest from this person after they pass away? They need to be properly perfused, right? Is it a good idea to discuss palliative care when an opportunity is presented in an obvious scenario where it is indicated? Yep. What do patients on clozapine need? What sort of tests? They need regular blood tests. Patients on clozapine need regular blood tests. If you suspect acute pharyngitis in your patient, you can use the Centaur criteria and consider getting what? Getting a rapid antigen detection test. Now, with regards to the Centaur criteria, you can look for tonsillar exudate, adenopathy, fever, and a cough. What do you want to screen pregnant females for at 24 to 28 weeks? At 24 to 28 weeks, you screen for gestational diabetes mellitus and anemia. If your patient is pregnant and they have a new onset of benign thrombocytopenia, what is the technical name for that? Well, the technical name for that benign thrombocytopenia during pregnancy is gestational thrombocytopenia. If you have a patient who's pregnant and is about to deliver their child, and they have severe thrombocytopenia, but they don't have contraindications to epidural, is it okay to give them an epidural? Yep. Note that prepubertal girls often get vaginal foreign bodies, so keep that in mind. If your hospitalized patient starts acting delirious, you want to check what first before you start giving them any medications. Right? Check their vitals and check their O2 levels first. If you need more info on a delirious patient, what sort of test can you get? You can get a UA and a CMP. If you have a patient that is combative, what do you want to give them? Haloperidol, right? With regards to postpartum blues and postpartum depression, what is the time frame cutoff? 2 weeks, right? Less than 2 weeks is postpartum blues, and more than 2 weeks is postpartum depression. If you have a patient on an SSRI, are they still able to breastfeed? Yes. SSRIs are not a contraindication to breastfeeding. If you suspect your patient has Addison's disease, what level do you want to check? Right, check the co-syntropin stimulating cortisol levels in a patient if you suspect Addison's disease. In a CLL patient, thrombocytopenia is what? It's a poor prognostic factor. 34 to 36 and 6 out of 7 days. Anything less than 37 weeks is preterm. 34 weeks to 36 weeks and 6 days is considered preterm even. So what will those babies need? 2 things, penicillin and corticosteroids. What medication is used to treat Rocky Mountain spotted fever? Doxycycline. Doxycycline is used to treat Rocky Mountain spotted fever. What medication is used to treat tinea capitis? Tinea capitis is treated with oral glycofulvin. Patients that have no one to take care of them and can perform the activities of daily living should move to a nursing home. Is that true? Or cannot perform activities of daily living. Those are the patients that should move to a nursing home. Okie dokie.